In today's video, we'll discuss Model Paper 3 for competitive examinations like Gpat. So let's see the first question. Which class of drugs decrease the viscosity of respiratory tract secretions? Antihistamines, vasoconstrictors, antitussives, expectorants. The correct answer is option D, expectorants. They help clear the mucus or phlegm from your airway. And the examples are guaifenesin, potassium iodide. Second question, physiological antagonist of histamine is epinephrine, ephedrine, norepinephrine, or none. So epinephrine is the physiological antagonist of histamine. It is a drug that produces opposite effect to that of agonist. Epinephrine antagonizes the action of histamine by acting on effector cells in a direction opposite to that of histamine. Antihistaminic drugs block rather than antagonize the action of histamine. Moving on, tetracycline should not be administered with which of the following beverages? Water, milk, orange juice, apple juice. The answer is option B, milk. Dairy products bind with tetracycline, preventing its full absorption. An abnormal heartbeat is referred to as bradycardia, arrhythmia, tachycardia, fibrillation. An abnormal heartbeat is arrhythmia. It is called arrhythmia. Moving on, pneumonia is caused by Diplococcus pneumonia, Corynebacterium diphtheriae, Bacillus pertussis, variola major. The answer is A, Diplococcus pneumonia. It is now renamed as Streptococcus pneumoniae. Phenytoin sodium or dilantin is used as an antihypertensive agent, anti-ulcer drug, antimalarial, anticonvulsant. So phenytoin is an anticonvulsant. Spironolactone is classified as loop diuretic, steroidal diuretic, carbonic anhydrase inhibitor, or osmotic diuretic. Spironolactone is a steroidal diuretic. It is an anti-androgen and aldosterone antagonist which is used in congestive heart failure, liver cirrhosis, and kidney disease to drain excess fluid from the body, which is obviously the function of a diuretic. The person in charge of State Drug Laboratory is Drug Controller, DMS, Drug Inspector, Government Analyst. So the person in charge is Government Analyst. The family of bale is Nitaceae, Rutaceae, Polygonaceae, Leguminosae. The answer is option B, Rutaceae. Presence of blood in urine is glycosuria, proteinuria, hematuria, ketonuria. Answer is C, hematuria. Faucher's test is performed to detect dash in urine. Glucose, bilirubin, blood, albumin. The answer here is bilirubin. Potent loop diuretic is furosemide, aminophylline, hydrochlorothiazide, metazolone. The answer is option A. Furosemide is a potent loop diuretic. Moving on to the 13th question, Lanoxin is a brand name of digitoxin, digoxin, Gitoxin, Lanaticide C. So Lanoxin is digoxin. 14th, spirits may be prepared by which of the following methods? Simple solution, distillation, chemical reaction, all of the above. So spirits are prepared by all of the above methods. How much of acacia is required to prepare 60 ml of cod liver oil emulsion which contains 75% of cod liver oil? 4.5 g, 6.0 g, 11.25 g, 12.5 g. The correct answer is option C, 11.25 g. The next question is, imipramine is used as tranquilizer, anticonvulsant, antidepressant, analeptic. So imipramine is an antidepressant. Which of the following is considered as differentiated product? Ranitidine, Zantac, paracetamol, isoniazid. I guess they meant like the brand name or the generic name. So the answer would be B, Zantac. Zantac is ranitidine only. Zantac is the brand name for ranitidine. A direct smooth muscle relaxant used in hypertension is papaverine, pralidoxim, physostigmine, pilocarpine. Answer is A, papaverine. It is used to treat many types of smooth muscle spasms. It is an opium alkaloid antispasmodic. Also treats erectile dysfunction. The drugs used in the treatment of amoebiasis is acetazolamide, Lasix, diadoquine, physostigmine. Diadoquine is used for the treatment of amoebiasis. Now the 20th question is, all drugs are amphoteric in character except amphotericin B, enalapril, tetracycline, phenobarbital. So here phenobarbital is the answer. It is a weak acid. Amphoteric means the drug can behave both as an acid and base. So the answer is option D, phenobarbital. The next question is, hip joint is classified as ball and socket joint, hinge joint, gliding joint, or pivot joint. Hip joint is a ball and socket joint, so the answer is option A. Vaccination against smallpox was discovered by Edward Jenner, Pasteur, Alexander Fleming, James Lind. Edward Jenner discovered smallpox vaccine, which is the world's first vaccine. Another name for camphorated opium tincture is camphor spirit, tincture of opium, paregoric, laudanum. And the answer is option C, paregoric. It is a traditional patent medicine which has antidiarrheal, antitussive, and analgesic properties. Procaine penicillin G plus probenecid. This type of combined drug effect is addition, synergism, potentiation, antagonism. The answer is potentiation. Combined effect of two different drugs exceeds additive effect of each of the drugs administered independently. One drug is said to potentiate the other. So the overall effect is very much increased. All of the following are freeze-dried vaccines except BCG, yellow fever, DPT, measles. The answer is diphtheria, tetanus, pertussis vaccine, option C.